When you're pregnant, it's likely that you will have an anatomy ultrasound exam to evaluate the growth and development of your baby. This video will explain what happens during an anatomy ultrasound exam and what it can tell your healthcare professional about your pregnancy. What is an anatomy ultrasound exam? The anatomy ultrasound exam is generally performed at around 18 to 20 weeks of pregnancy, although it can be done at other times during the pregnancy. It checks the following things about your pregnancy. 1. The number of fetuses, fetal position, and fetal heart rate. 2. Head-to-toe survey of the fetus to assess the organs and body parts. 3. Fetal size. 4. The amount of fluid that surrounds the fetus. 5. Position of the placenta, the organ that provides nutrition and oxygen from you to your fetus. What should I expect at my anatomy ultrasound? The anatomy ultrasound can take up to 1 hour to perform. Most ultrasounds are performed with the pregnant person lying on their back, although sometimes they are asked to lie on their side. A gel is then applied to the pregnant person's belly to help the sound waves travel from the machine into the body. This makes it easier to see clear pictures of the fetus on the screen. It is best to remove belly rings and not apply any creams prior to your ultrasound. The ultrasound probe, called a transducer, is placed onto the person's belly. The operator moves the probe to see the different parts of the fetus inside the uterus. Sometimes, an ultrasound is done using a probe inserted into the vagina. You will be told if this is recommended or may be useful in your care. Are there different types of anatomy ultrasounds? Yes, there are both standard and detailed anatomy ultrasounds. A standard anatomy ultrasound is the ultrasound exam that is offered in most pregnancies. A detailed anatomy ultrasound is performed when findings on a standard exam raise suspicion for an anomaly or when there is higher risk for an anomaly or syndrome. What are the reasons for a detailed anatomy ultrasound? Some common reasons for a detailed anatomy ultrasound include 1. Maternal condition, such as lupus, pre-existing diabetes, or heart disease. 2. Suspected fetal abnormalities. 3. Increased risk for genetic abnormalities. 4. Suspected problems with the cervix or placenta. Or 5. Advanced maternal age. Are there limitations to ultrasounds? There are certain limitations to ultrasound. It cannot detect 100% of abnormalities. Things like maternal obesity, fibroids, or previous surgeries, as well as the position of the fetus and gestational age, can also limit what can be seen during an ultrasound exam. If you have any questions about your anatomy ultrasound or any other part of your prenatal care, ask your healthcare professional. For more information, visit highriskpregnancyinfo.org.